Transpancreatic precut papillotomy versus double-guidewire technique in difficult biliary cannulation, prospective randomized study. Introduction. In endoscopic retrograde cholangiopancreatography, ERCP, selective biliary cannulation by the standard technique has been reported to fail in 5% to 10% of cases, even in experienced hands. Difficult cannulation is an independent risk factor for post-ERCP pancreatitis, PEP. Bailey et al. Reported that the risk of PEP increased incrementally with each attempt at the papilla to greater than 10% after 4 or more attempts. Prolonged and repeated attempts at biliary cannulation can cause more injury to the ampulla and lead to PEP due to obstruction of pancreatic duct outflow. Unintentional cannulation of the pancreatic duct is also a risk factor for PEP. There are 2 problems associated with difficult cannulations: how to achieve biliary cannulation as soon as possible and how to reduce PEP, especially in unintentional cannulation of the pancreatic duct. The present study was an effort to answer these 2 questions. There are 2 ways to assist bile duct cannulation with pancreatic guidewire placement. One is the double-guidewire technique, DGT, which requires the use of a guidewire to physically occupy the pancreatic duct and another guidewire for bile duct cannulation. The other is transpancreatic precut papillotomy, TPPP, which requires a sphincterotomy over the guidewire in the pancreatic duct. The way to reduce PEP is reported to be prophylactic pancreatic stenting, which initially requires the introduction of a guidewire into the pancreatic duct. The objective of this prospective study was to compare the success rates for bile duct cannulation and the complication rates of TPPP and the DGT when both were associated with prophylactic pancreatic stenting. Background and study aims. Difficult biliary cannulation and unintentional pancreatic duct cannulation are thought to be important contributors to pancreatitis occurring after endoscopic retrograde cholangiopancreatography. Our aim was to compare and evaluate the rates of success and complications of transpancreatic precut papillotomy, TPPP, and to the double guidewire technique, DGT, both with prophylactic pancreatic stenting. Patients and methods. From April 2011 to March 2014, patients with difficult biliary cannulation, in whom the authors planned to first position a guidewire in the pancreatic duct, were enrolled, and 68 patients were prospectively randomly allocated to 2 groups, TPPP 34, DGT 34. The authors evaluated the rates of success and complications for each group. Results. TPPP had a significantly higher success rate, 94.1%, than DGT, 58.8%. The rate of post-ERCP pancreatitis was 2.9% in both groups. There was no significant difference between the 2 groups in the overall rate of complications related to cannulation. Conclusion. If biliary cannulation cannot be achieved, TPPP should be selected first after unintentional pancreatic duct cannulation.